It usually begins as an irregular growth of tissue called a polyp on the inner lining of these organs. If not treated, these polyps can progress into cancer cells. The colon, also known as the large intestine, is divided into distinct sections, such as the transverse, ascending, descending, and sigmoid colon. Each team has its specific qualities and roles in the digestive system. 1. The transverse colon is positioned horizontally in the upper abdomen, stretching from the right side to the left side before transitioning into the descending colon. Its primary role involves absorbing water and electrolytes from digested food and aiding in the further breakdown of food through bacterial action. 2. Positioned vertically on the right side of the abdomen, the ascending colon extends from the cecum, a pouch-like structure at the end of the small intestine, and ascends towards the transverse colon. The primary functions of the ascending colon include absorbing water and electrolytes and processing waste material. 2. Descending colon. The descending colon begins at the left side of the transverse colon and extends downward on the left side of the abdomen. It eventually leads to the sigmoid colon. The descending colon continues the process of absorbing water and electrolytes while also storing and eliminating waste material. 3. Sigmoid colon. The sigmoid colon is an S-shaped portion of the colon located in the lower abdomen. It follows the descending colon and connects to the rectum. The sigmoid colon is responsible for the final stages of water absorption and solid waste, stool, formation before it is eliminated through the rectum and anus. It should be noted that colon cancer can develop in any part of the colon, including the transverse, ascending, descending, and sigmoid colon. Regular screenings, such as colonoscopies, can aid in the early detection and diagnosis of colon cancer when it is most treatable. Colorectal cancer is another term used to refer to colon and rectal cancer, both of which can start in the rectum. Rectal cancer originates explicitly in the rectum, the final segment of the large intestine located just above the anus. It is recognized as a distinct form of cancer from colon cancer, primarily affecting the colon or large intestine. Rectal cancer, like colon cancer, usually begins as a polyp on the inner lining of the rectum and can develop into cancer if not identified and treated. Because they are closely related and have similar traits, colon and rectal cancers are commonly referred to as colorectal cancer. Screening techniques like colonoscopies are employed to examine the entire colon and rectum to identify any abnormalities or signs of cancer. Early detection is essential for effective treatment and better results in both forms of cancer. Colon and rectal cancer can be treated with surgery, which can vary depending on factors such as the stage and location of the tumor, as well as the individual patient's needs. The main objective of surgery is to eliminate the cancerous tumor and any nearby lymph nodes that may be affected. In cases of early-stage colon cancer, a colectomy may be performed, which involves removing the affected part of the colon and reconnecting the healthy sections. This procedure can be done through open surgery, with a large incision, or through minimally invasive techniques like laparoscopic or robotic-assisted surgery involving smaller incisions and specialized instruments. A partial or total colectomy may be needed if the cancer has spread to nearby lymph nodes or is more advanced. A partial colectomy removes only a portion of the colon, while a total colectomy removes the entire colon. After the colon is removed, the small intestine is typically connected to the rectum, or a colostomy may be performed. Surgical procedures for rectal cancer may vary depending on the tumor's location and stage. These include local excision, transanal resection, or more extensive surgeries like a low anterior or abdominoperineal resection. In some instances, a temporary or permanent colostomy may be necessary, which entails creating an opening in the abdominal wall for waste elimination. Following surgery, additional treatments such as chemotherapy, radiation therapy, or targeted therapy may be recommended to reduce the risk of cancer recurrence or to treat any remaining cancer cells. It's important to note that the choice of surgery and other treatments is highly individualized and depends on various factors. The treating physician or surgeon will evaluate the case and provide the most appropriate treatment recommendations. Matthew, thank you for spreading awareness, and I hope this video reaches a broad audience.